If it's okay, we're gonna record. So I want to welcome everybody to Coordinated Community Response. And to say we just a little background for anybody that's new, and you could go ahead and start putting your information in. Karen has started doing that for Family Promise. And I do this as Family Promise of Bristol and also Appalachian Promise Alliance. We started doing these meetings during COVID. We met weekly when things were crazy and changing day to day, not to mention week to week. And after time, we came down to one time a month. And we are thrilled to be able to continue doing that. We also started recording them when we have guests, and we have a YouTube channel. So I encourage you to go back and check some of the ones that you might have missed. We've had some really good ones that have been very helpful. So today, Beth Rhinehart is unable to be with us. She has a standing Friday date, so we couldn't even figure that out. So in a second, I'm going to start the recording that I did with her. And then I told her we would get back with any questions. So hopefully you all will have some observations and questions to have, and then we can get back with her on that. Before we do that, just a reminder for our next meeting, we're going to combine, funny thing, the fourth weeks are usually Thanksgiving and Christmas. So we are combining November and December and going to do December 5th at 11. At this point, I don't have a program to announce. If you have something in particular you'd like, you can message me and let me know what you would like to hear about. We try to do things that are pertinent to both Tennessee and Virginia audiences, and we sometimes have had like representative, we had housing authorities and we had both of them presenting, so we can do that, or something that covers both sides, or something that one region is done that's pertinent to the other region as well. So also we work with Bristol Coalition, which has been around for many years, and they meet on the second Tuesday. That's November 11th at 12 noon. I didn't check to see if Veterans Day is a holiday on that day for them. So watch that. I usually send those out, forward them. Some of y'all are on that list as well. So, and they usually, I learned what the program is on Friday before the Tuesday. So that'll come out with that. So with that, and again, just welcome to everybody. And we will go ahead and I will attempt to share my screen, and we will see if that will work with the recording. So Beth, and we're sorry you can't be with us in person, but we're so grateful that you can. Does that work? Everybody see it? Alice, nod your head yes.
Yeah. Okay. The sounds
hear it well yet, though, from my standpoint.
The sound's not great.
Maybe I need to change it. I can hear you better than I can hear the video.
Okay, yeah. Hopefully it'll get better.
Yeah, you're great. The video was kind of squelched.
Okay, let me know so we can see if we can do anything to change it. Hey, Aaron Scott, you're showing up as on there. So, hey, all right, we'll try it and see how it goes. With this via your Zoom presentation. So Beth Rhinehart is the president and CEO of our Bristol Chamber, and she is active in a lot of different areas. We just finished talking a little bit about passenger rail that we all get excited about. And recently, they received a grant to look at economic mobility. So Beth is going to give us reports from that study, and when we're done, I'll email out links or access to the reports that will have more information than any of us ever could handle. So we're greatly appreciative initiative. And Beth, I'll turn it over to you and get started.
Well, thank you, Margaret, and I appreciate the opportunity to share this work because it's our community's work. It's not the chamber's. We helped facilitate it, but we had over 100 stakeholders participating in this, and was really exciting. I have to tell you, if you like collaborating on things, this is your cup of tea, because we got to bring all kinds of frontline folks who are providing services in this space, and we have great information. We brought them together in stakeholder groups, as convening the entire large group together a few times, and it was really neat to see what we learned from that, things that I didn't know were happening here in our community, but more importantly, to hear from those folks who are doing the work. What does it look like on the front line, and where are the challenges and opportunities? So this was a lot of fun to do this in that respect, because the relationships you develop through processes like these really are invaluable. So I want to start, I'm going to let you see here just very quickly, the grant itself came from the Association of Chamber of Commerce Execs Foundation, and they actually awarded 11 grants. It was they were a sub grantor, so the funds came from Ascendium, and ACCE Foundation, managed the whole grant process and the allocations. But 11 chambers from around the country were awarded this, and they broke it into, I think, 5 different categories. And the category that we were awarded was in a community-wide visioning and strategy document and process, and it makes a lot of sense because we sit on that state line. And they saw us as a great model because, we have 2 city plus 2 county school systems. We have 2 local governments. We have 2 of a lot of things plus. And so it's really neat to be able to try to bring all of these best practices and work together to see what everybody's doing collaboratively across that state line, because we know what we know, and we often find that we kind of stay in our bubbles sometimes and don't really know when things are going on elsewhere. So that was a great opportunity to bring both sides together and work on this. So a little bit about what it was. So it was for rural communities, and just wanted you to see really what they deem in terms of rural communities. But it wasn't necessarily just a rural community. It was if you're serving folks that you touch in your footprint, that would be deemed by the Census Bureau population map a rural community. So they had some flexibility, in other words. So it was really nice to see that. And they gave us some other information. They gave us a ton of resources, and I cannot tell you how invaluable their support was to us, because we had monthly, if not more often, cohort calls where they brought in experts around the country who were working in this space, who had some of them were very specific targeted topics. They gave us resources to utilize. They gave us opportunities to work together. I learned so much from my cohorts in there, and I think we all did from one another, being able to share what they had at their fingertips that we might not have been aware of and be able to use. So one of the things, I know you all are probably aware of that, is MIT's living wage calculator, and it was one of the identifying pieces for well-paying jobs, and what does it mean in terms of trying to help people economically. And I'll say one of the things that we ran into also is, we're probably all aware that economic mobility has taken on a little bit of a politicized aura as well. We look at it strictly from how are we as a community, where are the opportunities and the challenges for helping people move forward into well-paying jobs. And that encompasses a lot of layers of other things. So just basically, those were some core concepts. So I want to go back to this document, which was our finished product. And it's not, I will tell you, it's not a professionally put together document, but it's comprehensive of the work that we did with some of the low-hanging fruit and options for future plans. So take it for what it is based on that. So our next generation opportunity, which was our cross-state strategy for economic mobility, has 2 QR codes. And I want to make sure that Margaret gets all of our information to you as well. I'll show you a little bit about the resources on this QR code, and then our dashboard that was developed, that's on our website at the Bristol Chamber, that tells a lot about the demographics and attainment rates for education, ingress and egress of folks that come into this community to work. Where are they coming from? How many from our community travel outside for other jobs? So there's a lot of great data on here that we were able to pay for through this grant. And if you go to bristolchamber.org, the economic mobility dashboard is on, or the economic dashboard's on our front page, or you can get to it from this QR code that you all will have. So with that, I wanted to move through some of the contents of the final product that we developed. Again, this is all of our work. It's not beholding to the chamber by any means. We just facilitated and helped coalesce all the information together. So let's go down to there. We just had an opening message talking about a little bit about why we did this, where we got the money from, and that we had some incredibly strong partners to be able to do that. And I will mention Eric Fields and John Van at the Summit Companies, because they helped facilitate these meetings. They helped drive the conversation. They helped with planning. We spent a lot of time just talking about what are we trying to accomplish here? How do we get there? What do we know already that we don't know? Who needs to be at the table? And we were constantly meeting between our stakeholder groups and refining those conversations so that we made it as robust as it could possibly be and as meaningful as it could possibly be. We go on down to one of the things we worked on initially was defining economic mobility as a group. And we just came up with a very broad definition that describes economic mobility as the ability of people to move up or down the economic ladder within a lifetime or from one generation to the next. And also put some more definers on that, which was it requires access to things like income, assets, training, employment, but also things like basic food, water, power, social inclusion, and there's some links there. But really that it was dependent on, at the end of the day, economic mobility was most influenced by partnerships and relationships and mentorships. And I know that we all know that if you work in this space, you know that sometimes it takes just one person's connection that helps you move forward. The other big piece that we talked a lot about was the cliff effect. Folks who are trying very hard to move to a next level, and you may have support services that you desperately need at one point, and you get to the point where you're making just a little bit too much money or a little bit too much of whatever it might be, and you all of a sudden lose those supportive benefits that take you back to square one again. So that was one of those things that was really important in all the conversations as we work through this. And there's a benefits cliff tool that we look to. Sometimes it was created by the Federal Reserve Bank of Atlanta, and that link is on here as well. So a little bit of background, we as part of this, because we also presented this to other people around the country, other chambers, wanted to tell them a little bit about what is the footprint for Bristol, what is so unique about Bristol. And of course that state line is one of the many things, but it's one of the things that really had a lot of impact on the work that we did for this grant. We gave some of our demographics here, talked about some of the assets, and I'm not going to go through these because it's something you can read in your leisure time, but just to know that that's what this is, and just talked again about why the strategy was so important. It talks about how our labor shed is approximately a 1-hour drive. We know that people live in Whitfield that work at Eastman. We know that people live in Johnson City that work at Strongwell. We could go through a million scenarios, but that's so important in our strategy because we're not isolated to the borders of the cities of Bristol, Virginia and Bristol, Tennessee. And here are some of those demographics that I mentioned on our dashboard that is on our Bristol Chamber homepage, if you want to take a look at that as well. So the process, we, as I mentioned, worked with Eric Fields and John Van as our facilitators, and we met out there. They were very gracious with their space to allow us to do that. If you want to know a little bit more about them. But one of the things that I was a little bit embarrassed that I didn't know about was a database. I don't know the right word to call it, but it's a website that basically allows someone to go in there and put in what your need is. I could go in and put my name. I needed help with rent or something like that, and it takes you through a matrix of resources that you may not have even known that you needed. And so it's not a one and done, like, I need help with this, so we'll take you here. Thank you. It takes you through a very matrix type journey of trying to get people the greatest support and help they can. And that's the servingtricities.org website that they have. And if you want to go take a look at it, one of their challenges with that, if people are looking to help, is keeping that up to date so that all of the organizations and nonprofits and others that are working in this space, that their information is in there. It's as robust a database as can be, but also that it's up to date. In our community stakeholder meetings, we looked at what were some of the core systemic issues defined, but also the core qualities and values of our region. Those core values being faith, family, grit, pride, hard work. There's so many. We kind of beat these to death with a lot of conversations because they were so easy for people to rattle off. And then we looked at what were some of our core systemic issues that would be barriers possibly or challenges for people to move upward in their mobility. And as you can see how many we identified, everything from multi-generational poverty to the drugs that are coming into our region, new or more diverse set of job opportunities, the core value of and the benefit of work. Again, kind of going back to the multi-generational poverty, people feeling and seeing that sense of value that comes from earning a paycheck, but also having seen that modeled somewhere in their lifetime from a parent or another family member and the importance of that. Benefits cliffs, I won't go through all of these because it's something you can go back and read through, but housing and transportation needs that we know, childcare accessibility and affordability, our growing homeless population, mental health and behavioral health, cultural stigma that we know still exists to a degree. And then kind of the dilemma from all of that is that we have traditionally been in this region, that very strong Scotch-Irish culture of pride and hard work. And then the question was raised, is that grit and hard work and prideful kind of approach to life, is that still as prolific as we were always kind of known for it to be? So we went with the approach. Again, the group decided when we had our stakeholder meetings broken out into sectors, we were looking for a couple of things. One was to seek collaboration among all the stakeholders, and two, don't reinvent the wheel. Build on, learn from, and solidify the strengths and support the strengths of the programs and the services that are in place that are best practices. So that was one of the approaches we all agreed upon. And then the targeted lens for our stakeholder discussions was looking at our Alice families, our youth, our justice involved in second chances programs, and our adult workers that are transitioning or upskilling. And those were really some of the targeted populations of folks that we felt like, because otherwise, if we keep looking at everything, we could have spent years working on this. So we took that approach. I'll tell you about some of the stakeholder groups. Our housing and transportation stakeholder group, you can see what they developed through those conversations. And I have to say, it was the hardest thing to do these stakeholder groups because everybody had so much experience and value to add to the conversation that everyone wanted to share, which was the greatest thing ever. But trying to wrangle that into common consensus around things was hard because there's a lot of passion around people that are doing this work. And that was also very motivating to see and to hear all the great things that the impacts that are happening that maybe we did not know about. And that, you know, again, we kind of stay in a bubble, so we didn't all know that. So these were the outcomes of the housing and transportation stakeholder group. And again, I'm not going to read everyone there, those that are there, but you can see from some of these, a lot of these are probably no-brainers that we're going to go through. But we confirmed that consensus through these stakeholder group meetings and hearing from everyone that was able to attend and participate. So housing and transportation stakeholder group, then the education and workforce development stakeholder group. And we talked about some things like our labor participation rate. And we look at that number, but I think what's more important is those that are not in the labor workforce, where are they and why are they not in there? And that's probably the golden egg of the questions. Everybody wants to know, why are those that are not in the workforce, why are they not in the
Okay, we'll see what we can do. Oops. I may have really messed it up. All right. Let's see.
Easy to do, Margaret.
Say what?
then?
There we
Easy
go.
to
Strategically,
Here we go.
work with those individuals to try to get them
Here we
back
go.
into the workforce. We have infrastructure challenges, which again is no brainer for transportation. A lot of less rural communities and more metropolitan based areas have much more robust transportation opportunities. Everything from passenger rail to city transit to Uber and Lyft, you name it. And also, some folks have more built communities where you can walk to work and you don't necessarily have to have a vehicle or a bicycle to get there. We had some real specific examples given of things that were happening, but I think one of the things that came out too in looking at the justice involved population of workers is the grave need to scale those programs up quickly. That there are programs out there, but they're somewhat isolated, and in order to get the greatest impact, we've got to scale those quickly and replicate those as much as possible. We talked with community colleges, how they were dealing with transportation issues as well. We talked about how to better educate our students on what overall opportunities are there post high school, and identifying those students before it's too late for them to make all the choices they want to make. You know, not everyone wants to go to a 4-year school. Not everyone wants to go to a 2-year community college. Not everyone wants a trade. Not everyone wants to go in the workforce. So making sure that we're identifying all of those students who may not know what they want to do, and to make sure that they have what they need to make informed decisions and to have the resources and people to help them get to where they need to be in the right amount of time. So investing in life coaches, digital access was a big conversation for sure, and how we make sure that our students have access to that, and that is an equitable access journey for them. We had the healthcare and childcare stakeholder group, and some of the immediate barriers you can see that were identified there. And some of these are similar across different stakeholder groups. Medications are expensive, lack of affordable workforce housing, childcare and specifically shift workers' childcare availability and affordability, putting mental health services back in the communities. That telehealth is critical. Again, you can see some of these, and most of these probably don't surprise you terribly. One of the things was looking at the Medicare wage index that our hospital systems are struggling with, because there are parts of the country that get paid 5 and 10 times more for the exact same service from a physician than they're paid in the more rural communities, and how that imbalance makes it even more difficult to recruit specialists to our region and to all rural communities. And then some of the other opportunities defined here, working with employers on how we deal with employee needs and challenges, how the benefits cliff does not incentivize economic mobility, need for more community navigators. That payer mix for providers is low here, as we just mentioned, in the Medicare wage index. So moving on to the supportive and basic services stakeholder group. And one of the things that kept almost being screamed in these was remembering that most of the people that we're talking about who are being served in all of these service provider in the front line of that, most of them are already in crisis, or they're a step away from crisis, and how that makes it makes it easy to do short-term decision making sometimes that is maybe not in the benefit of longer-term stability approaches, and remembering that when people are in crisis, what that looks like when you're working with them, and what kind of challenges that can create, but the awareness and how important that is. We talked about financial literacy as a critical piece, not just for our youth, but for our adults. And that school counselors and staff are pushed into, we know this, doing a lot more than school counseling academically, and the need for that. Stress the desperate need to address generational poverty. Unite Us, talked about that as a platform. It's a great platform, referrals. And I have to say, United Way was a great partner to us in this, and because they had the touch to so many organizations that they were able to connect us with. And again, digital access and literacy, and how important that was. Moving on to the community safety, justice involved, second chances stakeholder group. So came back to a real defining understanding of we need community navigators, peer mentors, case managers. And Margaret, I know we're preaching to the choir here with some of the folks that you all work very closely with. Defining a safe community, from physical safety, but also that perceived safety for differing demographics, and how important that is. And we know in rural communities, that perception is sometimes real, and sometimes it's the perception is real, but the truth is not always what we think it is. We talk about needing a unified strategy for the process when we interact with our unsheltered transient folks, and then that connection to the police departments. And I know there have been great progress made here in that realm, with a lot more work to be done, but that came out as a really important factor to consider. Domestic abuse, we need to strengthen programs for IDs, and mitigating the fine debt that people end up in, so that we can help people feel like they can get out of a position that they might end up in once they are released from incarceration. And the fact that pay isn't great when people do have employment, pay is not always great, and often someone has to leave to open the opportunity for a career advancement. For example, in our fire departments and our police departments and other, that a lot of people stay in those jobs. There's a lot of longevity. And so upward mobility is not as easy sometimes, and these were from the mouths of the folks working in that industry, for sure. So digital equity, we've listed some of the resources here. It's amazing. We have a 10 gigabit community here in Bristol, Tennessee, and BTES's footprint. We listed Point Broadband, Spectrum, and Brightspeed because digital access and equity was a big part of the grant that they wanted us to look at. So these were helping to identify some of those resources. And then we came to bring the whole group of 100 stakeholders back together and talking about presenting these specific stakeholder results, but then talking about them openly, and then getting some really good and strong feedback from the entire group. And one of the things that really screamed, depending on which stakeholder group we worked with, we found that some folks were more enthusiastic than others, and not that there wasn't a passion, and not that there wasn't every bit as hard a work, but that the folks that worked with the youth seemed to have the greatest sense of hope and positivity in their responses. And that shouldn't be probably that earth-shattering to us, but it just shows us hard work. And you know, to see results, sometimes you have to be very committed and dedicated and not give up and keep working with folks, even though it may be hard. Margaret, you had something? 5 minutes. Perfect. We're getting close to it, so that's perfect. Also underscored how economic mobility is critically connected to relationships and dependent upon that. The need to take this one bite at a time. We can't solve it all overnight, even though we wanted to after these discussions. It was pointed out that self-sufficiency is a little bit of a misnomer. And we had someone make, you know, you have those aha moments when people are talking, and this individual said, none of us are in this together alone in this world. None of us survive singularly. We have families, we have co-workers, we have community mentors and service providers. We have all these people that impact us throughout our lives. And so they felt like self-sufficiency was a little bit of a misnomer, which I thought was a really interesting perspective. And that it truly does take a village of all of us working together. We need a clear understanding and a mapping of all the resources and services that are being provided and what the collective impact looks like across all of those services, especially when you have that state line that sometimes not intentionally, but people stay in their own funding footprints. And that we couldn't take for granted that our targeted population understands all this terminology. And just that, you know, everybody's committed to doing that. So I do want to say John Van went and did 14 community interviews with employers to get their perspective on what they're seeing when they look at employees who may have challenges, and got some really great data. These are all redacted, so you don't know who's who. You just get all the great information. And I'll scroll through these because that'll be something great for your reading. But it was really interesting to hear from that employer perspective, and John going in as an unbiased, just I'm gathering data for this grant with a promise not to share individual company names. So we got some really good information from that. Get down here, see where we are. All right. So then identifying the opportunities for success and some of the low-hanging fruit, and there's more here than you would think. Advocating for a living wage. We know that it seems like low-hanging fruit, but then advocating and accomplishing that are two different things. And how do we get there? Talking about transportation, focusing on financial literacy and digital access, upscaling programs that help provide IDs for the justice involved folks, helping to support and build out the Serving Here website that Eric Fields has developed there out of their office. A youth summit, which I'm glad to tell you we have scheduled for November 25th from 10 to 1 at King University. We have about 100 juniors and seniors coming from Bristol, Virginia's high school, Bristol, Tennessee's high school, and Sullivan East to talk about essential skills, talking about just opportunities for them to get employment, have junior achievement there. They'll do a campus tour. They'll get fed lunch and have an inspirational speaker. So that is planned for November 25th. And then we're bringing back the 8th grade workforce tours, a little bit larger scale that we've done here for many years that we found great success with. We listed all of our community partner participants. Again, just amazing group of folks who stepped up. We had, as part of this, we got funding for a housing summit in Town Hall that was held on October 9th. Here's an entire document. When I give you all if you go to that scan document, it will take you to a Google Doc folder. There's a whole housing folder in there with tons of information on the work that was done, their recommendations. We had about 100 attendees there. We would have liked to have had 300, but you take what you can get. And so that was one piece of this. And then again, all the resource links to information we needed and used, things that were shared. There's a lot of great resources in here that use opportunity hours. You can go on there and click on a zip code and it will tell you a lot of identifiers that are all based on research, what the likelihood for success of a child born into that zip code looks like. It's a little bit scary on some of those, but it's also very eye-opening and gives you a lot of information on how we approach the work that we do. And again, the needs assessments from Ballot Health, from the Sullivan County Regional Health Department, the Mount Rogers, couple of really great articles, the Urban Institute. There's so many different examples of things that have been done around this that were really fascinating to read. So the appendix, once you get to the Google Doc, the appendix is outlined for everything that's listed in that folder that you will have access to. And that's the end of that. I don't think I had anything else. Oh, I will show you very quickly. So this is the Google Drive that is from that link. And it has this Housing Summit folder, has a bunch of different articles in there, and our executive summary of the event and the recommendations that were made there, but also just some really good other documents that we use, some best practices in the chamber industry as well, and just information that's good for you should you have that interest. So with that, Margaret, do you have any questions? I tried to talk quickly, but tried to go over everything.
Right. It is a ton of information, and this is going to be a huge resource for people to be able to look at and see what can be helpful in their work. But can you define, as y'all use the economic mobility again, just to say how y'all define that?
Yes.
That was at the very beginning, but just to say that again for what?
Get that back up here. Go back up to the top.
Sorry.
No, it's fine. That's a great question. It's right up here. So, and we threw out probably 10 different definitions from what we found. And then we also asked the group to review them. They broke out into smaller groups and did some wordsmithing on them. And we came back with it, and again, it's broadly defined, but that it is the ability of people to move up or down, because mobility is two directions, right? We hope it's positive mobility, but the ability to move up or down the economic ladder within a lifetime or from one generation to the next. And that's also, I think, really important here in our community, is that generational shift that we hope is positive and forward by giving our youth the opportunity to see pathways that maybe the current generation did not.
I think that's good. This group will talk a little bit. We'll get back if we have any questions that we hadn't figured out how to answer from what we've heard. And thank you for a lot of information, and you have given us the tip of the iceberg for all the good stuff that's in the report. So we we appreciate it very much for your time, Beth, and y'all applying for this grant and taking it on. So, and we can talk more about who's taking it forward. Does this enable us to be eligible for other funding, where we all could help look for that, just however we can do to help move things forward. So,
well, and if I could real quickly on that, I really appreciate that, because again, the goal, we were facilitators of this and had access to a lot of the training and resources to bring to it. But the goal here is, once we have this overarching plan, is that individuals, nonprofits, other organizations, or community leaders find areas in this that were identified, and that other people have that desire to step up and say, hey, we want to tackle this, or we want to do more with this. We want to build on what's already happening. We want to replicate this. And this belongs to the community. So it's whoever really has the capacity and the resources. We don't have any additional funding yet, but who knows, maybe more will come. They've surprised us in the past. And this is also a great resource. If someone wants to apply for a grant to work specifically on some of this, you can take any and all of this information plus, and if we can find more for people, we're happy to apply for grants that may target some of these very specific opportunities for improving economic mobility.
with that, thank you very, very much, and we'll get back to our meeting. Thank you, Beth. Thank you.
Thank you. Appreciate it.
All right. Okay, are we back?
Yes.
Good. So, all right. Thank y'all. And I should have told you it was about 36 minutes ahead of time, so you knew what to expect. Anyway, so how many people on here participated in a focus group? Did any of y'all participate? Alice is raising her hand. Anybody else here participate in a focus group? Ellen, you're being very weird. She's raising her hand as she comes in with interesting video. Okay, so Renee, did you participate in focus group? So I know I participated, I think, in a couple of different times that they had. They completed stuff maybe last August, and then their report was due last November. So, and we're getting the results. What did anybody learn anything new, anything surprising from anything that we heard from Beth? Or mostly was it just reinforcing what a lot of us already know and work with, since the focus groups represented a lot of what we do?
I'll speak up. I think this kind of work is long overdue and indicates what people working together can accomplish when they set their mind on accomplishing various important metrics or goals for a community. This is just, of course, I knew Beth from before we were talking about stuff, but she's obviously the very, very strong leader to make some of this happen as well. I was wondering about the other communities, whether their chambers of commerce would step up and even apply for this kind of funding. You know, it's kind of like, wow, this is a wow factor.
Yeah, and originally I think there was possibility of getting some future funding. I don't know if that's still out there or not, but to have the planning grant and then perhaps some more funding. So I know something that I found interesting and glad that people brought forward was the idea of self-sufficiency. And I know in Family Promise, when they talk about being independent or self-sufficiency, that includes help from things that people are eligible for, whether that be WIC or food stamps or whatever, so it's not necessarily being completely financially and whatever independent. I also think that more recognition, more discussion. We certainly are reading about it. We certainly experience it in lots of ways, that how critical community is, and how we in the US have been geared toward independence, that we stand on our, and Appalachia sit on our own bottom or bucket or whatever, and want to be independent, and that many other societies around our world are much more community oriented, and people work to support each other, which I think we do that, particularly in times of crisis. But I think there's lots of things, Friday night football, there are lots of things and lots of ways that perhaps we expect people to be independent. And it would be a lot healthier if we expected people to work in community and help to nurture that. What other comments or thoughts do you all have from what Beth shared?
So I was wondering whether the grant specified a next, or was it just to collect the data? Because when she talked about low-hanging fruit, I thought about all the different kind of initiatives that are kind of starting or wanting to start now, and wondering, do we tackle the low-hanging fruit, or do we need a 5-year plan? And if so, how would that happen?
Good thinking, Alice. So it sounds
And
like,
also, is this document available? I missed the QR code, so
yeah.
I can't find it
I'm
on
going
the
to send
site.
it all out. I'm going to send out
Yeah.
the link. So,
Okay,
and
thanks.
certainly y'all can share that. I'll send it as quick as I can after this, and then I'll send the YouTube later. And certainly you can share all of it for other people, and share it with any groups or your boards or anybody you want. And it certainly within the document has lots and lots of links to more information. From what I gathered, and we certainly can ask more specifically, that there at this time there's no further dollars connected with this planning. So that is, and at this point there hasn't been further collaborative approach, right, to try to pull the participants back together again. So I think that it's wanting for some initiative to suggest that or move on that or whatever. So that's my observation.
Well, and I mean, I'm not sure how many people on this call are at the Health Council, but they're looking at a way to do it. There's a lot in this report that gets us closer to that blue zone model. But again, just even having a way to track who's doing the low-hanging fruit until there's more money would be helpful.
Other comments on anything? Want to add to anything else said, or oh, come on, somebody wants to say something. And I'm sorry we aren't doing major introductions. I did, so it means I keep making comments. So I did, and I'm not looking at my chat like I should. I did think that crisis decision making, I think that's also important. That's where we talk about ACEs and trauma, and some of that crisis decision making isn't just crisis decision making, it's whether people have the ability to use all of their brain capacity with the lack of connections or whatever with ACEs. So I think that's needs to be sure to be understood and how important that is.
Margaret, I'll chime in. You said you wanted to comment. I think it's interesting that some of the focus groups thought that our older population isn't as well positioned as our young folks. And yet, Alice just mentioned that we've got this great plan for becoming blue zones. And that, fits right into, Tony DeLucia and my age and all kinds of things that we're seeing with getting people with their wealth coming down here and changing the nature of our population. But that seems like a little bit of, we're sort of swimming against the tide of what the state is talking about. I know Commissioner Alvarado is all about that blue zone stuff. I love it, but I'm taking heed of what this says, and I think we can do both.
Yeah, and I can send out a link if y'all aren't familiar with blue zones. And Alice referred to Sullivan County Health Council that's had several discussions, and people come to talk about blue zones. And if you have Netflix, there's I think it's 4 hours program that's on the blue zones. And the blue zones are called blue zones because the people who studied longevity and healthy communities circled the ones that were at the top in blue, so they called them blue zones. And then they further talk about it. It is, if you do their official program, it's quite pricey, it's expensive. So it's figuring out if there's ways to pay for that, or ways to do it in a less expensive way without using the top experts. So she did talk about Positive for Unite Us. For those of you on here, how many people use Unite Us regularly? Can you raise your hand? Casey, okay, several. Aaron, good. Okay. Good. And y'all give it, so that's good. So do y'all give it good reviews for how it works for you? If it's a good review, put your hand up again.
I think the way that I use it is probably a little bit different than how some other folks use it, but yes, I think it does.
Good. And maybe we need to learn that too. So I know there's some frustration. I know with Family Promise, we already have to do HMIS and we have to do some other reporting. And so it's difficult to add in another, but can use it for the referrals when needed. Same thing, Salvation Army has 3 different things that they have to report to, etc. So, but it can help when you use it.
Margaret, I'll chime in with a comment
yes.
on Unite Us. Again, I'm not in Bristol, I'm in Johnson City,
Right.
But we've, anecdotal, reports that I've gotten from different service providers are the issue that you just mentioned about having multiple platforms that you're needing to keep up to date. Particularly if you're turning on the referral, component. If you're just advertising, hey, we have a food pantry at our church, then it's really easy. We do it on Saturday morning, here's the address. But if you're wanting to use all the bells and whistles on the platform, it's a whole nother platform to manage, which is adding another thing on already overstretched social service staff to have yet another thing to manage, another tool to monitor. There's also been some concern shared about Unite Us being a for-profit company and what's happening with the data. I know that there are some service providers that have been reluctant to participate and utilize it because of that. And I know that there are duplicate tools, like I just learned at Second Harvest Food Bank's event last week in the state of Tennessee. TennCare has helped fund a new platform called Tennessee Community Compass, but it's only Tennessee specific. So again, for us thinking regionally, when things stop at the state line, it just becomes difficult to scale and get consistent implementation. So just thinking about, that type of feedback, the feedback that service providers are continuously providing about do people know what resources are out there? How do we get a comprehensive list? How do we make sure people have access to that list? I guess my question is this information that's come out of this research, which I'm glad the chamber did it, is this stuff getting communicated to elected officials to say that these are persistent problems that we keep getting solutions offered to us, but those solutions are not being readily adopted for various reasons, and we're spending a lot of money developing systems and tools that then aren't really solving problems?
So I will follow up with Beth, but as far as I know, this is the first community report. And having participated in focus groups, one or two, at least one focus group, and then when they were pulled together at the end. As far as I know, there has not been a report back to the focus groups that participated. So, and no, not to elected officials, but it certainly could be scheduled, and that could be done to be shared, and certainly would be beneficial to do that. So yeah, so if any of y'all have ideas on getting this information out, as well as in the housing summit, that there's a link in the whole folder on the Google Doc. It has some fabulous information. The people, it was two organizations that worked together that came to do that as a pretty much all day workshop that was very good. And I don't know that that's been taken forward. So a lot of times we do things and then we don't take them forward, which would be very helpful. How many here have used servingtricities.org, or a newer name is Here to Help that she spoke about? That so a few yeah, I'm thinking we've had Eric Fields come in the past, but it's probably been 2 years. I'm thinking we might see if he could come in December and just go through it again and encourage us all to update information or put information in for the first time if we're not on it. So that's kind of what I'm thinking might be helpful for us to have. All right. And one other thing that I would like to share. Samantha Gray teaches parenting education. She does parenting education. She also coordinates Parenting Educators Network. So hopefully as many as possible that people know about for parenting educators. There's information on Appalachian Promise's website for all kinds of parenting education in all kinds of places in our Tennessee, Virginia region. But what Samantha talks about, and that is concerning, and particularly when we talk about community, when we talk about children being prepared for workforce, et cetera, that we talk a lot about affordable childcare. What we don't talk about is the ability for a parent to stay home with their child and to be able to provide the attention and help to raise children, as opposed to, which we know quality daycare is critical, but also quality parenting can be helpful too. So thank you, Ellen. And that we don't talk enough, and that's also in our work. I think we don't do enough creative, wonderful things to try to support parents to keep their children. So we learn about ways, and that's why, Linda, you're nodding your head, at least the Mountain Mission, it's a temporary while people can get their lives in order, and not going through the foster system that has a lot of bells and whistles, presumably. Anyway, but supporting parents to be able to keep their children. And the data, as far as I know, still is that kids thrive even in not situations we approve of, that being with their family and their parents is a stronger model than our foster care system or other programs. Anyway, that's a little bit of editorializing, but I think it's something that doesn't get talked about enough, and that it would behoove us to talk more. Also, one other, Beth referred to essential skills, which Appalachian Promise also tried to not call them soft skills, which sound very optional, and to talk more about essential skills. That's getting to work on time. It's understanding why that's important. It's knowing when to let people know things. And anyway, all the different essential skills, being able to work together in a group, etc. So I was very glad to hear that she called them essential skills. All right, well, with that, we're 3 minutes over. So I want to thank y'all. Anybody have any last word to say before we say goodbye and see each other on December 5th? At this point, I'm going to try for Eric to do the serving Tri-Cities. So, all right. With that, I think we're ready. So, thank you all very much. And Karen,